ഇനി US Weekly Roundup powered by PSG Group of Companies in Life and Health.
Thank you, Dr. Simi Jesto. Hello, everyone. My name is Dr. Rose Vadakara, and welcome to a new segment of Life and Health. In today's Life and Health, we are going to discuss about deviated nasal septum, also called as DNS. To discuss this topic, we do have a ear, nose, and throat specialist, Dr.Mona Patadia. She is an associate professor, and she is also the director of the ENT allergy, and she is a sinus surgeon. And it is my pleasure to welcome Dr. Mona Patadia to today's Life and Health.
Thank you so much, Rose, for having me, and thank you, Life and Health, for hosting me. I'm excited to be here today.
So, doctor, my first question is, can you explain what is a deviated nasal septum?
Sure. So the septum, first of all, is the line or wall that divides the nose in half. So it's made out of a cartilage and bone, and essentially it's between our two nostrils. And when it's deviated, it just simply means that the septum is shifted in one direction or the other.
Okay. What causes it? Like, why there is a nasal, like a deviation that can happen?
Sure, and that's a common question when patients present with the deviated septum. That's the first question they ask. It can be caused from birth or trauma due to birth, and then oftentimes it's also just due to any sort of trauma. So as a child, when they fall, it could be due to contact sports, roughing around with siblings, or any sort of injury such as a car accident or a bicycle crash, etc.
We all know that this is a very common condition. Like, most of us might have it. Some of them, few of us recognize it as like a nasal congestion, or we have some breathing difficulty. Then only we think that, oh, do we have a deviated nasal septum? What is the common symptoms like normally a patient will tell you?
Right. So normally patients come in and they complain that they have a hard time breathing through their nose. Most commonly, they'll say that there is a fixed obstruction or fixed congestion on one side that's worse than the other. But sometimes patients don't really pay attention to that. So they'll often come in and they'll just say, I just can't breathe through my nose. And I've, tried certain medications and nothing's working and I just can't breathe. Or, I'm trying to do yoga, or I'm trying to go for a run and I'm constantly a mouth breather. And those are the most common symptoms.
What happens if we don't fix this problem?
It's not a life-threatening symptom or problem is what I tell patients, but it really can affect their quality of life. So, a lot of patients, when they wait until they're older to get it fixed, one of their biggest complaints is they wish they got it done when they were younger. Okay. It can also cause snoring. Some patients, it may progress with sleep apnea symptoms as well.
Okay. So how can we fix it? Like, without doing a surgery, can we just fix it in your, with a non-invasive procedure at your outpatient?
Usually it is a surgery under general anesthesia, but it is a very common surgery, a very safe surgery that's done as an outpatient. Okay. There are some in-office procedures we can do as well. So instead of fixing the septum, we could reduce these little balls in our nose that are called the turbinates that are on the outside. And those are some in-office procedures that we can offer to patients as well.
Okay. What are the surgical procedures that you do?
So the most common procedure is what's called a septoplasty, and that's done in the operating room under general anesthesia, and we do everything through the inside of the nose endoscopically, so there's no incisions on the outside of the face, and that allows us to essentially straighten or remove the parts of the cartilage and bone that are crooked.
Okay, so what is the success rate for this procedures?
Yeah, so success rates are quite high. Ultimately, when we fix things, it should stay nice and straight. Rarely things can shift mildly. Ultimately, it just comes down to what I tell patients is what their symptoms are. If their symptoms of congestion or stuffy nose are due to a deviated septum, the success rates are very high. If your symptoms of stuffiness are due to allergies or other things, then maybe you're not going to get the success rates that you desire.
All right. Yeah. So thank you so much, doctor, for answering all the questions. It was very useful. I'm sure a lot of people would definitely look into it, like both invasive procedures and also outpatient. Yeah. So thank you so much for joining with us. It was a pleasure to have you today.
Thank you so much.
US Weekly Roundup powered by PSG Group of Companies in ഈ എപ്പിസോഡ് ഇവിടെ പൂർത്തിയാകുന്നു. നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും ദയവായി asianetUSnews@gmail.com എന്ന ഇമെയിലിലൂടെയോ 7324299529 എന്ന വാട്സ്ആപ്പ് നമ്പറിലൂടെയോ ഞങ്ങളെ അറിയിക്കുക. മറ്റൊരു വൈവിധ്യമാർന്ന എപ്പിസോഡുമായി വീണ്ടും കാണാം അടുത്തയാഴ്ച. നന്ദി, നമസ്കാരം.
Preface Law Firm, Chicago. Trusted name for work injuries and personal injury cases, wrongful death cases and much more. Ensuring aggressive financial results. Attorney Stephen Preface. Serious lawyer for serious cases. We want a long-term relationship with you. Call us 312-855-0511. Preface Law Firm Limited. www.prefacelaw.com.